Thank you, Speaker. I want to take this opportunity to talk about the rising cost of living. It's an issue that is affecting every person and every household within my community. I believe that in this very parliament, we've got to get serious about this issue. As everyday necessities such as groceries, electricity, mortgage repayments and rent continue to skyrocket, the people of New South Wales need a government that is serious about addressing cost of living. According to an article published by the Daily Telegraph, families are $3,000 more worse off today than they were before the Albanese and Minns Labor governments came to power. At a time where grocery prices have risen by 30%, families should not be choosing between keeping the lights on and putting food on the table. Speaker, women are often the ones who manage the household budget, and they are making tough decisions when it comes to household finances. I've spoken to many women in my community about the rising cost of living and the way it is impacting them. I condemn the Minns Labor government for their cuts to IVF treatments across New South Wales. These changes announced at the end of November 2024 are a significant step backwards. For so many families, the journey towards parenthood is not easy. 1 in 7 couples has fertility issues, and 1 in 16 New South Wales children are now born through IVF. By means testing, this often medically necessary service for so many women, the government is adding additional hurdles to family planning and increasing the strain on family budgets. For these families, IVF sometimes is not a choice. It is an essential service that ensures all couples are given the opportunity to raise a family. During this difficult, emotional and expensive process, the IVF rebate scheme provides much needed relief to families, especially during a cost of living crisis. The IVF rebate was introduced under the previous Liberal government as part of an $80 million expansion to ensure access to IVF remains affordable for families. Under the previous program, the $2,000 rebate was available to any New South Wales family who had incurred an out-of-pocket cost from a private IVF program after the 1st of October 2022. Under the new means-tested program, which was implemented last month, beginning 19 February 2025, women in New South Wales will only be eligible to receive the rebate if household income tests are met. This includes receiving the family tax benefit, having a healthcare card, or having a household income of $116,000 or less. In real terms, that means that if each partner has an income of $58,000 or greater, they are not eligible for this rebate. To put that in real terms, that's nearly $20,000 less than the starting salary of a New South Wales public school teacher, for example. We know birth rates are declining in this country, and we should be encouraging and supporting women and families, not putting up financial roadblocks and limiting access to essential healthcare services. At the federal level and internationally, governments are investing significantly in fertility research and IVF treatments because they understand its importance. Yet here in New South Wales, the government is taking steps in the wrong direction. As it stands, the average Australian woman is having 1.5 babies, a trend that would see sharp declines in our population over the coming decades. In order to maintain our population, it would need to increase to 2.1, but this can't be achieved while the government continues to slash public funding for IVF treatments. According to IVF Australia, the average out-of-pocket expense for a single cycle of IVF is $6,265, with subsequent cycles costing $5,568. Studies from the UNSW suggest that only 1 out of 3 women will fall pregnant during their first cycle of IVF, ultimately pushing the cost of treatment into the tens of thousands of dollars. While I understand that this $2,000 payment doesn't cover the full cost of IVF, it goes a long way to making treatment more accessible. Speaker, as a young woman, I find it particularly disturbing that these cuts will disproportionately affect women. IVF is a difficult process, and these cuts will add additional financial barriers for women. The government has claimed these costs are about budget savings, but cutting IVF rebates is not a responsible saving measure. Instead, these cuts are a short-sighted decision with long-term consequences for families across New South Wales and particularly across my community. Women should not have to choose between paying their bills and starting a family. I thank the House.